Mental health concerns are back in the headlines after a young man's deadly attack last Friday near the UC Santa Barbara campus. Doctors and hospitals nationwide are continually looking for new strategies to improve the outcomes in mental health patients, which might prevent future incidents or attacks. Patients at Beth Israel Hospital in Boston are among the first ever to have access to their psychiatric records, and studies suggest the initiative, called Open Notes, could be successful. Now we explore it in this week's Inside Your Health with Dr. Arkell Giorgio. Dr. Giorgio, thanks for being here. First of all, why don't you explain to us what this means? What are Open Notes?
Open Notes is a national initiative that gives patients access to all their medical records. And what that means is even their doctor's notes, which have traditionally been totally off limits.
And that's surprising. I mean, I would think most people would think that it's their own file, it's their records, they have access to it, but that's not the case.
Well, since 2002, you legally have access to your doctor's notes, but it's so hard to get them, read them. It's such a hassle. Effectively, people don't have access to them. So this Open Notes initiative makes it easy.
Okay, so what are the benefits to being able to see your own file, see your own notes?
Well, there was a large study done pretty recently that looked at the benefits to patients who had Open Notes, and what they showed is that 99% of those patients, even when the study was done, wanted to continue to have access. 85% of them said that they want their doctor, they would select their doctor based on whether or not they gave them access to their chart through Open Notes. And maybe the most important statistic is that 2/3 of those patients were more likely to take their medications as prescribed. So better outcomes.
And I would guess some doctors will be on board with this, and some doctors might not be on board with this.
Well, right now, Open Notes is in 12 hospitals across the country. About 2 million people have access, but there are some barriers to doctors agreeing to participate in this. Some of them is that doctors are scared. What if I write something that my patient's going to freak out about?
Right.
So they're fearful. But there are some practical considerations, and one of them is that doctors use abbreviations when they chart their notes. So here's an example. It's on the screen. If we put up 1POQID, does that mean anything to you if you saw it in your Open Note chart?
I'd have no idea. I'd guess Latin something, but I have no idea.
It's Latin something. It's Latin something for one by mouth 4 times a day. So doctors would have to be retrained to write that out so that when their patients access their charts in the Open Notes, they would be able to understand them.
All right, and that would probably be hard for some doctors who've been doing it the same way for a long time.
It's a transition. It would take a lot of influencing.
All right, Dr. Arkell Giorgio, thanks for enlightening us.